Welcome to part 2 of week 6, collaboration. So as an RN, you will work with a combination of regulated and unregulated healthcare personnel. Some regulated professionals will be from the same health profession, so RPNs and nurse practitioners, and others will be from one of the other 26 regulated health professions in Ontario. You will also likely be responsible for overseeing the practice of unregulated care providers. Each type of collaborator will have different skill levels and scopes of practice, and you are expected to understand who you are working with. You may still see the terms inter and intradisciplinary in the literature, but the language that is preferred today is inter and intraprofessional. Intra means within, and so intraprofessional means people who are in the same profession. So as an RN, when you're working with RPNs and NPs, then you would be working intraprofessionally. Inter means between, and so interprofessional practice or collaboration occurs when, as an RN, you are working with social workers, physicians, psychologists, etc. As with all collaborations, nursing intraprofessional collaboration should be respectful of all nursing colleagues, and each should work together towards optimal patient and healthcare setting outcomes. The right mix of nursing staff allows for flexibility and enables each level of regulated nurse to practice to their optimal scope of practice, which in turn contributes to positive patient outcomes. Everyone needs to be clearly understand each other's role and work as members of a team that is effective and engaged in positive ways. A factor that's been identified as important for effective and high-functioning nursing teams is when the RM and the RPN staff respect each other's knowledge, etc., and treat each other as autonomous practitioners, within the context of legal C&O limitations on practice, of course. The complexity of a patient's condition still influences the level of nursing knowledge that the patient needs. The more complex the patient's situation and the more unstable their environment, the more likely it is that an RN will be required to provide the full range of needed care. Collaborative practices across professions requires that everyone trusts and values each member of the team. It means that healthcare providers feel free to ask questions of each other without being afraid that they will be judged by other people as not knowing enough. Collaborative practice encourages healthcare practitioners to seek common goals, always with the patient at the center, and to work together to address any problems that arise. Professionals pool their information because they understand that no one healthcare practitioner has all the answers. When something goes wrong, then they help each other rather than lay blame. And when something goes well, then they celebrate the success. I count myself fortunate to have been part of some amazing interprofessional teams in my MP practice, and I can tell you that it really feels great to work this way. There has been a push in many educational and healthcare settings to provide education to help professional students learn how to collaborate as effective team members, so during their basic education, not just for continuing education. It is clear from both clinical practice and research that high-quality, patient-centered care demands high-quality, interprofessional collaboration in which the patient remains the focus of care. I have been a member of the Canadian Interprofessional Health Collaborative, CIHC, more or less from its inception, and I have been impressed with the resources and networking that takes place. The CIH framework for collaborative practice involves 6 main areas, and students within programs that provide interprofessional education learn a lot about 1. Each other's roles, 2. How to work effectively in a team, 3. How to communicate across professions. 4. How to resolve interprofessional conflict. 5. How to use collaborative rather than hierarchical leadership approaches. And all within 6. Patient, client, family, community-centered care. As more and more members of health professions are educated in this way, interprofessional rivalries are reduced and quality patient-centered care increases. We have offered a couple of interprofessional education activities between the School of Nursing and Kinesiology and Health Science students in particular, and one of our strategic directions for the school is to be more involved in interprofessional education. So we will discuss more about delegation and collaboration in our Week 6 Zoom meeting on Tuesday, October the 27th from 3 to 4. See you then.